Hello and welcome everybody. As you are coming in and filtering in, we're happy to see you. I'd love to have you drop into the chat. Tell us where you are. Where do you live? Are you pregnant? Do you have a baby? Tell us how many weeks pregnant you are. And then I'm going to introduce all of us, two people here. I am Jada, founder of Boober, and we have Dr. Dibya Subedi here from One Medical, and we will talk in a moment, but I would love to just have people start to let us know where you are. That way we know that you can hear us, first of all. Hey, Morgan, 23 weeks in Austin. Thank you. And who else do we have out here? We actually have, 36 and 5 in Chicago. I'm gonna launch this poll just so that we know who is here while you're telling us specifically. We got Dana, hi, 29 weeks in Florida. Awesome. Hi, Nicole, 29 weeks in New York. I'm in New York. 31 weeks in Brooklyn. I'm actually in Brooklyn. 36 weeks in New Jersey. Hey, Lauren and Yoav, 37 weeks in Brooklyn. Got 36 weeks in Manhattan, 23 weeks in LA. Fantastic. Who else is out there? We love to see this. It kind of lets people filter in, and we love to get that feeling that we're all kind of going through this all over the place, right? 27 weeks Manhattan, 40 weeks tomorrow in Mystic, Connecticut. It's exciting. 38 weeks in DC. Fantastic. Anyone else? Hannah and Milan, 36 weeks in Brooklyn. Lovely. So far it seems like almost everybody here is pregnant. I haven't had anybody check in that they have a baby yet. That's good for us to know. Helps us kind of see where we are. All right, I'm going to, hey, Sierra and Drayton, 37 weeks in Dallas. Phil and JC, 29 weeks in Manhattan. Fantastic. All right. So anyone else want to share where they are as we are just about to get started? Hey, Susanna from Queens, 38 weeks having contractions. We have somebody in labor with us. That is amazing. Thank you. We are all thinking about you. And we have a grandmother. Daughter is 37 weeks on Wednesday from Pennsylvania. Wonderful. Yes, we're definitely going to be talking about grandparents and visiting. We have Sarah and Kevin in Brooklyn, 30 weeks. Wonderful. Thank you all so much for coming. My name is Jada Shapiro. I am the founder of Boober. Boober is a platform where expectant parents and new families can find all of their pregnancy to postpartum care providers, such as birth doulas, postpartum doulas, lactation consultants, and mental health therapists who specifically focus in pregnancy to postpartum. We also actually informally at the moment are matching people to pelvic floor therapists, nutritionists as well, just so that you all know, sleep professionals. That's all coming onto the platform shortly, but we do want to let you know that we're a resource to help you find those providers that you need. And if there is somebody that you need that's not on our platform, we have such a wide network. Even if they're not with us, we are happy to get you that resource. It is very important to us as a platform that we are able to connect parents to the care providers that they need. I have been a birth and postpartum doula, lactation counselor, birth photographer, all everything for about 18 years now. I started another company 18 years ago called Birthday Presence, which provides childbirth education classes and doula training to the New York City area. We've served over 20,000 parents since then. And now all of that is coming to Boober. So we're really excited to be offering, in addition to all of the services, a lot of wonderful classes. So we do webinars like these with experts, and then we have wonderful childbirth education classes, infant CPR and safety, kind of all of the classes you need to prepare. Everything, most things I should say right now are virtual. In the New York City area, there are some service providers who are going in person, and we're able to support you virtually, all of you, wherever you are. So join us for more webinars, classes, services as needed. And now I would like to introduce Dr. Dibya Subedi. Am I saying your last name right? I just want to make sure you say it.
Yes, absolutely. That's perfect. Thank you.
Wonderful. So Dr. Subedi is a board certified pediatrician seeing patients aged 0 to 18. She strives to partner with families so she can provide the best holistic care for children from birth to adolescence. She loves the fact that the practice of pediatrics is centered on preventative care, and that the key to being a successful pediatrician is providing effective teaching and anticipatory guidance. She's especially interested in providing breastfeeding support, education to new moms and parents, as well as early childhood development. Dibya received her medical degree at the University of Virginia and completed her residency in general pediatrics at the Children's Hospital of Philadelphia. And you can come see her if you're in the area, or not, I suppose. We've got a whole virtual system here, right? The newest, One Medical's newest family practice office on the Upper East Side. So we are happy to welcome you here to talk today. We're going to be talking all about, this is really for you all, the parents, as you're starting to, you're pregnant, navigating COVID with having a baby, with what that looks like in the first moments after birth, what that looks like for having visitors, what it looks like in those months after, especially as we go into the winter. We just think it's really helpful to have a pediatric expert who you all can ask questions of. I have some of the questions that you submitted before, but as questions come up, if you could go down into the Q&A, you can just drop those questions into the chat, into the Q&A question box, the chat, if it's something we're talking about right then, and I'm going to be monitoring both. So I'm going to have you go, Dr. Subedi, if you could tell us about yourself.
Absolutely. Thank you for that introduction. I'm Dibya. I'm a pediatrician with the One Medical Group, and I see that we really have a wide audience, nationwide audience. So I'd love to introduce One Medical a little bit for those of you who aren't familiar with the organization. It's a primary care organization with offices now throughout East and West Coast, as well as expanding offices in Chicago, for example. We also have offices that are coming up in Austin in 2021. So keep an eye out for a practice coming near you. In New York, we have, I believe, about 11 total offices, and 6 of them provide care for all ages. They're family practices staffed with pediatricians and family practitioners who see all ages. Our goal is really to create a great patient experience and to create a great, comfortable environment, especially in today's world, for you to get all of your primary care services in one location. It is a very tech-powered primary care company. You have 24/7 access to our virtual medical team, which is staffed with amazing PAs, NPs, and physicians. They'll provide virtual video calls. They will answer your clinical questions. You also have an easy platform to communicate with your provider, such as myself. I am personally located in the Upper East Side location. It opened just about a month ago. We're on 65th between Lex and 3rd. If you're in New York and Manhattan, come see us. But check out the website, check out all the other family medicine sites and all the providers to see who might be a good fit for you.
All right, thank you. So I wanted to start with talking about the first moments after birth, really. If you could walk parents through, there's a lot of questions and concerns here. We talk, in our newborn care classes, we teach a lot of those newborn procedures. And right now with COVID, we always talk about skin to skin contact as one of the best ways to help encourage initial lactation and initiation of lactation. But we have a lot of parents concerned about what happens if they test positive for COVID. Will they have a routine separation of baby and parent? We understand that we've been shifting away from that, but I would love your clarification on, can babies be in skin-to-skin contact after the birth, as long as all is well with them, if the parent is COVID positive?
Yeah, and that's a really important question. Actually, I think the way we can approach it is encouraging each of you to start that discussion with your obstetrician and your planned hospital that you're planning to deliver at before you go in for that admission, before you go in for your baby, to kind of get a sense of what the hospital policies are right now. They have evolved a lot in the last 6 months as we've learned more about COVID, as we've learned more about transmission, and we've learned better how we can keep families and babies safe. I do not currently practice in any one of the New York hospitals, so I can't attest to any specific policies. But you are right that there's been a general trend. I would say there's a general practice of providing education to families ahead of time to let them know if mom tests positive and you we keep the baby in the room in with mom, which is the standard and preferred practice. What are the risks and how can we mitigate those risks? And the ways to mitigate those risks might be doing rooming in, but having mom always wear a mask when doing skin to skin or breastfeeding, making sure that we're practicing really good hand hygiene. And I say mom, but really parent, to mitigate any risk of transmission. And it is, at the end of the day, what I want to emphasize is that all families feel empowered to ask these questions and think about what they want out of their birth experience and how they want to make sure that their baby is nurtured and taken care of and kept safe from COVID, but also provided the best care from the moment that they're delivered. And start having these conversations early. Prepare yourself for the discussion if it were to come up. I don't want it to feel like this is what's going to happen to you. It's really about the collaboration with the birth hospital.
Absolutely. And that's something we really stress as well. All the parents out here, expecting parents, the more you talk to your care providers in advance, right? So you can talk to your midwife or OB right now and find out how is your particular hospital or birth center kind of approaching, first moments. Just in general, actually, even pre-COVID, that's something that we always recommend and advocate that you really engage with your care provider to find out how that works. And then, of course, understanding that if the baby is well, there's a set of circumstances. If the baby needs special care, additionally, it's possible the baby will be not on your chest while it receives that care, while they receive that care until they can be brought back to you. But we always want that to be so like a collaboration. So bringing it up now helps, right?
It depends a lot on hospital capacity in terms of testing and testing turnaround. There's so many things at play, but I think it's best to have a clear answer and clear expectations.
Absolutely. And of course, all of us are national here. So everybody's dealing with different levels and rates of COVID. We know that protocols are changing really regularly. Right. So keeping that connection and following, although I sometimes say, like, some of you who are earlier, if you're 20 weeks today and you're here watching, 20 weeks from now, when you're giving birth, the protocols may be so different. We'll be in such a different place that I think we don't need to stress quite as much about what the protocol is until we're in those weeks leading up as we start to really research what's happening. Yeah. So can you talk to us a little bit about first appointments? Now, we understand that many people are being asked or gently pushed out, I guess, of the hospital after giving birth more quickly than they used to be, although we're seeing that change a little bit as well. So after a vaginal birth, maybe, 1 day instead of 2 days, or after cesarean birth, 3 days instead of staying for 4. Can you speak a little bit about when you are doing the first appointments with parents? And we have a lot of questions around virtual versus when should I actually come in? Which ones are critical that I do need to see you? How are you doing that these days?
Yeah, great question. So you're right that for the most part, I'm still seeing that moms are they're discharging a little bit sooner than they would have a year ago. And I think it has advantages and some disadvantages. The big thing, of course, is, as you know, lactation and breastfeeding, it really evolves in what we're trying to accomplish in the first 24 hours, which is just get some good skin to skin, get mom and baby acquainted, get them to have a little bit of colostrum. It evolves from that to good feed when milk comes in the first few days. And I think the hard thing about leaving the hospital early is that you don't have the hospital lactation consultant to lead you through those stages. And it's possible that, parents are being under supported, especially first time parents in those first few days. That just brings me back to see us early. Generally, we expect to see babies for their first appointment about 2 to 3 days after they leave the hospital, but it might be sooner. And there are a few factors that would push you to schedule that appointment sooner. And there'll be an in-hospital pediatrician that makes this recommendation to you as well. So if there are any issues with jaundice, if there are any challenges with breastfeeding, or honestly, if you have any question at all, all of the typical well baby visits, and the schedule kind of goes, we see you 2 to 3 days after the hospital, then we'll see you about a week later, and then 2 weeks, 1 month. It's pretty frequent, But I think it's crucial that all of those early visits are in person, because, or pediatrics, especially early on, is really about preventative care. We need to make sure that we're checking for jaundice, both with our exam and also with any lab evaluations if necessary. We want to make sure that we're getting really accurate growth measurements, and we want to make sure that our exams are great and remain normal. So in the first year, all of the typically recommended visits, I would strongly recommend that they be done in person. Which would bring us to, in the days of the pandemic, how do you handle this? And what I would say is, again, just like you're having the conversation with your care provider and your OBGYN and your care providers and that team, try to think about who's going to be your provider early on for your child. So try to pick out a pediatric practice or a family medicine practice, and have a conversation with them about their safety protocols, and make sure those are aligned with what your expectations would be. And, I can speak for One Medical. We encourage families to reach out to us to schedule a meet and greet, which can be done virtually. And we can lead you through our practice style. We can lead you through our practice offerings, and we can also talk about our safety protocols. But the way that we're able to handle safety in the time of COVID is that, one, we prefer to see babies early in the morning, so you kind of get in, get out. Mm-hmm. Two, we have a commitment to be on time and see all of our patients on time. So even before COVID, our waiting rooms were pretty empty, and we're able to continue to manage that. We screen everybody that comes in for any COVID risk factors or COVID symptoms, so we can make sure that your provider is in adequate PPE, that, if there was anybody who screened positive, that we're in adequate PPE, that we're able to isolate, that we're able to make sure that we have heightened cleaning protocols. So, and those are examples of what we're doing. I have no doubt that every practice has thought about how they're going to handle care appropriately for young children. So reach out to them ahead of time, make sure that what they're telling you feels good, but plan to take your babies in person for all these visits, and also for early childhood vaccinations, because, we certainly don't want children to be delayed in the time of COVID.
Yeah. Thank you. And it sounds like, again, really important, check in with your particular practice now. If something, as you brought up, like, it should make you comfortable, right? So if something doesn't make you comfortable, it could be an indication that you might want to spend some time talking to other practices that would make you feel more comfortable. This is a long relationship, right? Exactly. Potentially.
Exactly. So, you want the practice to kind of fit your style and make you feel like you can have a trusted relationship, or you can have a partnership for a long time, even outside of COVID. But then, as you're establishing that, you also want to talk about the specifics of these protocols. It's possible that you would want to go see an office in person if that's something that's available, just to kind of really settle things for you.
But if it does come into a situation where we go into a greater lockdown, depending on where you're living, then I presume that each practice would share which ones might turn into a virtual visit, if any, versus which still would be.
Yes, absolutely. And, to the extent that telemedicine has been wonderful and has provided us really wonderful tools to continue discussions with our families and provide them with the right care, direct them to the services that they need. While I emphasize that these early childhood visits are really crucial to be done in person, we can certainly offer remote visits for anything else that seems appropriate, like crashes, or their parents might have more questions. We might be guiding them through feeding early on, things along those lines. And we've been lucky to be able to expand our telemedicine services, and you could schedule a remote visit with the provider that you know best anytime.
Yeah. Thank you. We have a question that just came in that is relevant to this early period, so I wanted to get to it. We have somebody who's 35 weeks and 2 days pregnant with twins, and they are asking, if they deliver before 40 weeks, does that mean the babies will be in NICU until 40 weeks? And is it shorter with COVID? Are there any NICU differences that you are able to speak to?
That is a great question. So Some of this depends a little bit on the hospital that you deliver in and what the capacities of a newborn nursery or that ward is relative to the capacities of the NICU. And that really varies hospital by hospital. So it's hard for me to say, in this hospital, if you deliver at 35 weeks, where you would end up. But I can tell you that it's babies don't have to make it to 40 weeks full term. If they are doing well, late preterm babies can stay with mom, do all the things that you expect babies to do, and go home. So you are already at 35 weeks, assuming that your babies are a healthy size. They might just be able to stay with you and get routine newborn care. So don't fear that you're going to be in the NICU for 5 weeks.
Right, definitely. And also I do want to speak to anybody who might find themselves having a NICU situation. If you are needing additional support, postpartum doulas, lactation counselors as well, we do support people who are trying to navigate lactation or keeping up a milk supply or creating a milk supply when they're not necessarily able to stay in the NICU. I know you are all around the country, so it's very different in different places. Whereas in New York, we don't have as much room and people don't stay as long as the parent, even if the baby's in the NICU. They may need to come back and forth, et cetera. And so I just want you all to know that anybody on the platform can support you as a NICU parent, and anybody who gives birth here. Actually, if you need any lactation support, as you said, we're not having quite as much time in the hospital all the time to get that initial additional lactation support. So I do encourage everybody to ask to see the lactation consultant if possible, but it's not always possible, and the visits can be quite short if it's a very busy day. So do know that we pop in for virtual visits at the hospital with people. Sometimes if you just need an hour and you want somebody to kind of check in with you and make sure everything is well, or later when you get home if you need. And somebody writes here, thank you, that some pediatricians are offering a prenatal visit, which gives birthing parents or moms to be the chance to meet the pediatrician before the baby's born. Yeah, as you said, yeah, you can often maybe do a virtual visit to connect and figure out those kind of, see if it feels like a right fit. So I wanted to address and get to the visiting portion, because I know this is something that causes a lot of anxiety and stress for our parents here. Questions about, I'll go first with the postpartum support, since we have this question. They would love a pediatrician's perspective on safety guidelines for somebody like postpartum doulas who and the families they serve. So just so that everybody knows, in case you haven't heard of a postpartum doulas are people who provide transition support to parenthood, right? We help families transition to parenthood in whatever way that means, whether that's helping you with nursing, with feeding, with learning how to put on that baby carrier, with, helping count and track diapers, helping learn how to do the first bath, all of the kind of basic support. We are not only baby care, but we're you care. So we can also help with your perineum healing or your emotional kind of processing of having become a parent, sort of an all over supportive person. And traditionally, historically, postpartum doulas come into the home and stay with you, multiple hours or overnights or some amount of time. And now a lot of that support has become virtual. So some people are choosing in person depending on where they live and what's going on with COVID. And some people are choosing to have postpartum doula care in a virtual way, which has kind of been amazing. Actually, I've been enjoying supporting parents where I can just kind of pop in throughout the day and answer their general questions and be supportive. So I would love to hear, this parent here who wrote in wants to know, do you think something like once a week testing, they ask, limiting the number of clients that the postpartum doula is seeing? What about masks? Can you speak about all of that? Thank you.
Yeah, absolutely. I think the most important thing for all of us is, the kind of basic safety protocol. So I would recommend that for all of us providers that we wear a mask, and we really ask our clients, patients and families above the age of 2 to keep a mask on throughout our encounter with them, because that is going to decrease transmission. To the extent that it's possible, social distancing, acknowledging that care providers are not going to be able to social distance throughout the visit. But if you're able to kind of step back for parts of the conversation when you're not doing an exam or not assisting with something in particular to minimize your risk, I know it's getting colder, so it gets a little bit more challenging, but if you're able to promote good ventilation in a room, if you're able to crack a window, if the weather is okay, that would certainly reduce risks as well. And then really good hand hygiene. Those practices, I think, are probably the most crucial when it comes down to it. Testing, of course, is important, but it's also important to recognize the limitations of tests and what they mean. And that's just to say that, tests show you whether or not you are infected in a particular time frame. And somebody who tests negative today might very well be positive tomorrow and infectious tomorrow if they had a contact with someone a few days ago. So that's just something important to keep in mind. But I think that, we can incorporate testing into a strategy for mitigating COVID. There's no clear answer on the frequency of testing. But say if a group of doulas wanted to incorporate that into their strategy, every other week might be a reasonable time frame to get testing done. The last thing I would say is that it's really important also to think about risk factors and to kind of keep each other honest about what risks we're taking. Unfortunately, we're seeing a spread of COVID, a rise of COVID in much of the country. And what epidemiologists are now noticing is that it's become less clear where people are getting COVID. They're not able to point to a large gathering or, a high risk environment. It seems that increasingly it's happening in smaller gatherings and because we're traveling, et cetera. So it's important for any of us care providers to be honest about whether we are, if you've been to a high risk location where COVID is really spreading, if you have been indoors with a large group of people unmasked, all of those things would put us at higher risk. So that's, you want to mitigate those risks as much as possible. If there's ever a clear exposure to COVID, you certainly want to make sure that you are properly quarantining for 14 days and not relying on testing alone. And I think just when we get to travel and family members trying to make decisions about seeing each other, I'll discuss this a little bit too, there is the kind of absolute safest thing to do. And then there are various measures that we need to take in conjunction to try to really mitigate the risks of COVID in this kind of like Swiss cheese model. So for healthcare providers, it's not possible for us to just work from home and only take care of people from home. So we just have to implement all the other strategies to make sure we're decreasing the risks as much as possible.
Yeah, thank you. I mean, I think this is actually a good segue into the parent. I think it's with the postpartum doulas, the one last bit that parent had asked about, right, was limiting the number of families that the postpartum doula works with. And I do think that's a great conversation for you to have with any, with a postpartum doula you're considering hiring. Ask them. It's like what you said, really, we're trying to learn and get honest, hopefully, responses from people about what are they doing in their life at this time, right? And so are they working with one other family? Are they working, multiple times with many families? A lot of postpartum doulas I know on the platform are reducing the amount of families that they'll work with at a given time. They might take on more hours with a particular family, whereas we used to be much more loosey-goosey about, sure, I'll drop in with you for 4 hours today and I see 2 other clients tomorrow for 2 hours each. I think people are really approaching this differently right now. So really having that conversation, you have a right to have that conversation, and before you hire anybody, to kind of learn what they are doing and talk about what kind of testing you would like to see with them as well, because none of this there are no hard straight protocols, especially with postpartum doulas. It might be a little different with your pediatrician who is a medical clinical care provider, right? And you guys have a different stringent set of strategies. But thank you for all of it. Again, like the mask wearing and the hand hygiene and the social distancing to the extent possible, and the ventilation.
Yeah. And it's, I think ask your families to wear a mask and kind of contract for safety with you as well, because that's how you keep your whole community safe. And I think I've been very thankful for our One Medical families who have made this discussion, everybody is pretty committed to safety. But it can be a hard discussion, but I think that's really going to be what helps.
Yeah. So yeah, let's shift a little bit and let me ask you a question from a parent or a grandparent, I think. Hi, I will be flying from Newark, New Jersey to San Francisco to help care for my newborn grandchild mid-November. What recommendations do you have for ultimate safety for all? So I think you addressed some of them, but let's add also, since they're taking a flight and we have that question, right, from a lot of people. What if somebody's taking a flight? Is there quarantine or testing protocol for when they arrive? Anything that also, do we need to be concerned about the parents giving birth in the hospital and protecting themselves for the parents who are coming to visit their older parents? So could you speak to that?
Absolutely. Well, first of all, congratulations. And, you know, Jada and I talked about how important family connections are. And I know, especially right now, there's so many questions and so many hoops to jump through to kind of make these visits, but certainly we can work with you to come up with the best strategy. So first thing I would say is that state guidelines and state requirements for testing and quarantine are evolving pretty regularly. I am familiar with the New York guidelines right now, but I'm not familiar with the California guidelines. So first thing I would say is just try to take a look at what the state you're currently in, what it recommends, what your airline carrier recommends in terms of testing, and then what the state you're visiting recommends in terms of either quarantine or testing, just so you can be prepared and meet all of those recommendations. The next thing is the flight and what kind of risk it poses. This is, you know, something that's been of a lot of interest, and there have been a lot of studies recently to discuss how to mitigate risks on a flight. Masking, and if you really want to be doubly sure, you can certainly do eye protection as well, but masking is going to be the most important, and ensuring that really everybody in your flight is masked. Ideally, they're also distanced. So if you want to do a little bit of research into the airline that you're going to be using and what kind of protocols that they're taking to assure your safety. With masking and distancing and good hygiene and circulation of air in flights, they're generally seen to be lower risk than we would have, you know, maybe we would have worried about early in the pandemic, with the exception of a couple of flights where they have seen spread. So that's something to keep in mind. It might not be as high risk as we thought it was, but it is a risk, right? And anytime you find yourself in a situation where you think there was an exposure, the safest thing to do to ensure that you don't pass on COVID to family members or newborns would be to quarantine for 14 days once you arrive at your new destination. And quarantine ideally would mean that you're staying in a different location where you're not sharing space with the family that you're visiting. And so, you know, this goes back to that would be the safest thing you could do, period. I know that's not going to be possible for everybody, you know, so realistically, then we have to think about all the ways that we can mitigate risk further. If it's not possible to quarantine for 14 days and you are flying and you're worried about risk of spreading COVID, you're staying with a family member, you want to stay in a different room, you want to use a different bathroom, you want to limit the amount of time you share in indoor spaces. You want to try to do most of your socializing outdoors to the extent that weather permits. And you want to try to be masked and at least 6 feet apart. And try to do that for 14 days. If you notice any symptoms that are concerning, please get tested. If you're not symptomatic and would like to get tested, you want to think about the best time frame. So again, if you were on a flight today, you go get tested tomorrow and you're negative, you shouldn't be reassured that you haven't contracted COVID. The best time to get tested is probably 5 to 7 days after that flight. So you want to be, you know, if you want to be very cautious, go get tested 5 to 7 days, and then actually keep quarantining for 14 days, but have a little bit more reassurance. And this is, you know, these are all the layers to keep family as maximally protected. On the other hand, the same thing, you know, families who are asking grandparents to come in to help might be worried about their hospital encounter and how that might endanger grandparents who have risk factors. In that case, it might be best for families to stay apart in quarantine until 14 days after delivery. And then, feeling safe, having negative tests, if that's what you decide to do, you can come together and support the new one in your family.
Yeah, thank you so much. And that is one of the questions that has come up as well. Like if they are deciding to do that first 2 weeks quarantine, the parents who have given birth and want to wait before they have the grandparents or any other, helpers or people come in, a couple of questions for navigating the first few weeks at home with the baby. I mean, I can speak a little bit to it, but we'd love to hear anything that you have to share about if we do have nobody in the house with us. What kind of things are you thinking about talking with your parents about?
Yeah. And can I just, to the last point, the one thing I want to say is if you ever have any questions about how to really tailor COVID safety or how to really tailor this approach to your family, please feel free to schedule a consultation. I mean, this is something that we could provide virtual care for, and we can, kind of go through what are your risk factors, what are the family members' risk factors, how old is the baby, what states are you traveling between, and what's the spread? I mean, all of the kind of nuanced information, and really provide you some guidance about testing, because it's a little, as new testing modalities evolve, it all gets a little bit confusing and you want to get good information. So I do think that's something worth seeing a provider about. But back to your kind of current question about what do you do with baby at home now? In a way, so we always told parents to be very cautious with babies until the 2-month shots. In the first couple of months, babies are just developing their immune system, and any infection, any fever is an emergency that would land you in the emergency department for further evaluation. The first set of shots starts to provide some amount of protection, and baby's immune system improves as well. So we were always advising caution in those first couple months, especially as we head into the fall and winter and respiratory season. And in a way, COVID precautions kind of just augment what we were even recommending before. We'd always say hand hygiene. You want to make sure that little kids who go to daycare aren't kissing the baby, that you're not having a ton of visitors. You're really trying to get them to, tickle baby's feet rather than get it right up in their face. But with COVID, what I'm finding is that a lot of families, if they're seeing loved ones in the first month of life, are doing ideally outdoor socially distanced visit with masks, trying to make sure that we're interacting with the new baby from a distance. And that would be protective, not just from COVID, but from all respiratory viruses and the flu. And many of these other viruses tend to lead to more severe infections in babies generally than COVID. So taking all the general COVID precautions that you're already taking is actually pretty helpful, generally speaking. The other things, of course, please make sure that everyone that comes that interacts with you has had a recent flu shot, and the family members are also up to date on their Tdap boosters, because we want to protect your baby against pertussis, because these are other infections that can be severe in little ones.
Thank you. And actually, related to this question came in about what are the risks of or serious complications for newborns or infants compared to older kids, younger adults from COVID? If you could speak to that, now that we have more information than before.
Yeah. We have more information, but in many ways it has stayed consistent. Generally speaking, coronavirus, COVID infections, acute infections have been mild or moderate in young children. Teenagers have had symptoms that are a little more similar to adults, but for the most part, we've been very lucky to see that kids have been spared. In rare instances, though this is very serious, there have been complications from exposure to COVID that occur, a month, 2 months out. You might have seen several months back, we were seeing children with this inflammatory entity called MIS-C, which could cause some cardiac damage as well. Overall, that's still rare, and complications, hospitalizations from acute COVID have still been rare and much less likely in younger children and babies than in adults. With that said, there is a risk of transmission to neonates, to babies that are 1 to 2 months old from parents or family members that are infected, causing fevers, causing some respiratory distress that has landed them in the hospital. So certainly it's something to take seriously, but, to provide some more context about other viruses like RSV or flu regularly land young children in the hospital in the fall and winter. So COVID has been similar or kind of less virulent in children than those viruses.
Thanks. Yeah. And then I just realized I wanted to go back one question before so that we could continue just to address for a moment about people who are choosing to stay in quarantine for those first 2 weeks themselves. I always like to recommend that people, really think about, we talk about your circles of support. So if you are not having anybody come into your home, then really being, aware of who are the friends and family that you can call or have a video chat like this with, right? People who are really supportive, maybe who've had babies before and who get it and who can be with you, and who you can at least call upon in a virtual way. In addition to, of course, there's virtual postpartum doula support, there's your pediatrician, there's your OB or your midwife, right? Knowing that you have kind of all these layers of support. And I also wanted to bring up with you as well, right? We were talking a little bit before we hopped on this call about mental health support. And as I mentioned, when the pandemic struck, we always knew we wanted to have mental health support, especially people who work in the space of pregnancy and postpartum, because it's really specialized and it's really connected, to this big transition that we're going through in life. But during the pandemic, we, that may up some of the concerns and anxiety and potentially isolation. So I wanted to just address that. I want all of you to know that postpartum depression and anxiety are treatable when somebody knows about it, but we do need to know about it. We want you to know that we're here for you. You can always reach out to us. Can you speak as a pediatrician? Can people come to you if they're feeling, to their pediatrician if they're feeling not quite right?
Yes, absolutely. And in fact, every visit with new parents, I make sure that I ask both parents, family members, how they're feeling, whether they're experiencing symptoms of baby blues or whether that's kind of developing into a postpartum depression. It is incredibly important to me to normalize some of these mixed emotions and some of these challenging emotions that people feel, let alone the fact that we're in the midst of a pandemic, in the midst of an election. I mean, I think anxieties are just really, really high. And I think it's absolutely critical that, we be there to support families. And I want you to feel comfortable to come to me to look for resources. I'm so happy to hear that you are also another resource in our community. And this is such an important topic to me. I think, anytime that I'm making recommendations for quarantine or isolation or kind of recommending against certain activities, it breaks my heart knowing that we've all been doing this for 8 months and it's so hard. And having new babies is a time for joy. We always talk about how it takes a village to raise a baby. And here we are kind of asking you to do it in this isolated way. And I acknowledge just how difficult it is. But I really hope that the medical community, all of us, can be a source of support. Please do come to us. I mean, I try very actively to build our network of resources for postpartum support for moms. And I'd love to be able to be that person you can talk to.
Wonderful. And also, we do a class called Preparing for Postpartum for parents here who want to visit for that, to get more specific into that. I'd also recommend, there's lots of postpartum support groups, postpartum baby yoga, parent baby yoga that you can find online, especially if we are in an isolated state, that those things that you might never have thought about doing before. I'm just going to throw them out to you, to try and connect. It's been kind of amazing running different classes with a bunch of different squares of people and being able to have that connection and know that so many people are going through what you're going through. And sometimes you just have to find that place, and even having a nice, a flat screen connection to somebody else in a little box, which is not the same, it still provides deep connection and value. So I'm going to go ahead and recommend that. So I have a couple of different parents who are asking this question on the chat and in the Q&A. So should birth parents, those who are pregnant, expecting, should they quarantine at all prior to a baby's due date? So we have this question from one person in New York who says that some NYC hospitals are testing both parents upon intake. And if the partner tests positive, they're not allowed to stay in the hospital for labor. So that's where that question is coming from. And I also have another person asking the question.
Got it. Okay. I think that's a great question. So, the first thing is about whether parents should be quarantining. And I think I'd seen a question before as well about getting COVID while you're pregnant and whether you're at heightened risk. The data has been mixed to generally suggesting that infections in pregnant women might carry the same severity that they do in the general population. In other infections, we often worry that pregnant women have a sort of altered immune system or just kind of have an altered response to infections and might get more severely ill. So certainly we're keeping a close eye on the data. But that to me is a motivator to be really careful in pregnancy and especially in those weeks leading up to delivery. There have been really no documented cases of babies getting a coronavirus like through the placenta while they're still in the womb. There have been documented cases of babies getting coronavirus from their family members after delivery. So in order to prevent that and in order to avoid that, if you're really careful in the month leading up to delivery, you're going to decrease the chances that you're going to pass on COVID to your baby, right? As far as the policy of testing both parents and who's allowed to say that, I'm just not able to comment on specific hospital policy because it's just evolving between hospitals. But, it's, again, something that I would discuss with the birth hospital and discuss with your partner and see what decisions, what other alternatives are possible.
Right. Like, I guess the concern is if they are testing both and you really want to be sure you are, or as sure as possible, then potentially quarantining for, once the due window begins is a possibility, if that's a possibility for your life.
Right. And if it's not a possibility, you go to work every day, you're an essential worker, you can be really careful to make sure that you're masking. You can be really careful to make sure that you're self-advocating in any environment, asking people who are around you to put on a mask and put it on appropriately, to make sure that you're socially distancing and washing hands, changing when you get home, taking every precaution that you can. Not everything is going to be under our control, but I think we can do a lot to mitigate this disease. I think we've seen that in New York in the last several months.
Definitely. Somebody asked a question, are there any hand sanitizers that are safer or more gentle to use before touching your baby? Anything you can speak to?
That's a great question, and one that's been asked of me before. So really the hand sanitizers are going to be kind of second line in terms of how effective they are at cleaning your hands. Soap and water, 20 seconds, really kind of gets rid of the virus. Aside from that, so if you're using a hand sanitizer, you want it to be above 70% alcohol so that it's actually effective. If it's higher in alcohol, it's likely to be more drying. Hand sanitizers that have a little bit of aloe might just keep your hands smoother. But in general, once you rub that alcohol hand sanitizer on and let it dry, the alcohol is evaporated and there's no risk of, your baby getting any of the sanitizer from your hand. You just want to make sure they're nowhere near it and can't accidentally drink it.
Right. Thank you. So as we are rounding out, we have about 10, 12 more minutes. I just wanted to make sure that everybody knows I typed in One Medical before. I also want to thank Hatch, who's sponsoring this as well. Hatch Collection, if you many of you may have come from them, which is a maternity and postpartum brand. And I also want to let you all know that if you are on Instagram, if you want to go ahead and pull out your phones right now and follow @GetBoober, we do a lot of teaching there as well. So lots of great opportunities to learn about how to latch, how to prepare for postpartum, see some live talks that we do with people there. We have lots of teaching videos that we share as well. So we hope you'll join us there. We're also going to share an email with you after. So do open the email from us because it will provide you with some discount codes on future classes. And also I know that One Medical Kids has an offer for you all that will be coming as well. And And Dibya, did you want to share anything about that specifically?
Yeah. So, so One Medical is membership based, and we have a membership fee that kind of allows us to have this advanced tech support that allows us to communicate with our families. We do have a special offer for kids, which we'll send out to you in this email that gives a $25 discount for a year of membership.
Great, thank you. So I have a couple more questions I want to get to you. So somebody said, I realized that a negative test is only a moment in time thing, as we were talking about before, but if grandparents have been quarantining for most of the pandemic due to their own risk factors and have gotten negative test results within the past couple of days, any advice on having them in our home besides hand washing and not visiting if feeling well, right? So, and then if we do decide to allow visits from them, masks on the entire time? Is that what you were? Can you just reiterate? I know you spoke about this a little before, but we've got a couple more questions coming in, but like how much mask? So let's just go through that all again.
Yeah, absolutely. And I love this question because it highlights that the most important thing is safety practices, and that if you feel that grandparents have been really safe, they are either working from home or just have been home, are not unmasked in front of people outside their household, or having groceries delivered, overall, you can feel comfortable that their risk of getting COVID or transmitting COVID is going to be really low. And then so that's a great way to figure out how safe it is to visit with somebody, probably more so than just a random test, just as you said. And then the second question is, when they visit, masks on or off. It also depends on your family and your circumstances. If you and your partner and your baby are also home, not unmasked in front of other family members, getting groceries delivered, just not in any high risk situations, you might decide that you feel comfortable having masks off. Of course, masks on, socially distanced, having good ventilation with anybody outside your household is always going to be the absolute safest. But I also understand that many families are going to be deciding between, this is the absolute safest, this is the second safest thing for us to do, and making a choice between those two scenarios.
Right. And it's different if those family members are coming to live with you, then you might be practicing this way for 14 days, right? And then you're really essentially bubbled.
Exactly.
So we have a couple more questions. Somebody says, if you think your baby got COVID from family members, do they get a swab test at the hospital? Do you take to the pediatrician? Like what do you do if you think your child might be exposed or has COVID?
So call your provider first. I can speak to our practice. We can certainly swab any child, any age, and we can also advise you on the best time to get swabbed, what those results might mean, and how long to quarantine, who should quarantine, et cetera. I'm not sure if every practice in New York does testing in-house, but they can certainly direct you to the right place to go to have a young child tested. But I would first call your provider just to make sure that if they recommend testing, when they recommend it, and where they would recommend that you go.
Thank you. And we have a question here about daycare for infants. Both parents are planning to go back to work about 16 weeks after or during this time, but I'm sure we have lots of other people thinking about the question in various timeframes. So if you could just speak to your thoughts on daycare, that would be helpful.
Right. So we are starting to see more and more data come out that daycares and schools have not been super spreader kind of scenarios. Generally, they've been safe, and the transmission risks have been similar or lower to what's happening in your community. With that said, this is, again, you want to check out the daycare. You want to make sure that children under 2 are not going to be able to, or should not wear masks. But you want to make sure that the adults that are going to be providing care for the kids are taking really good hygiene measures, or masking, or socially distancing amongst one another to the extent that's possible. You want to make sure that there isn't crowding in the daycares, and the ratios of children to providers is comfortable for you. Outside of COVID, of course, the risks of other respiratory viruses, other communicable diseases is higher in a daycare setting, but that's fine, because most children are going to get something they're going to they're going to get better with all these other respiratory viruses. But that's something else to consider, because in the context of COVID, if you do have a child that's symptomatic, you want to make sure you understand the daycare's policies about evaluating or kind of keeping your child home or requiring them to get COVID tested, just so generally so you can plan and you can make sure that you have backup care.
Yeah. And somebody asked, they have a partner who's a medical provider. Should they always be wearing a mask when interacting with the baby if they're continuing to be out working?
It's been a difficult time as a medical provider, trying to make sure that we keep our families safe. So the truth of the matter is that it does seem that healthcare providers are a little bit at a higher risk of getting COVID, and household members of healthcare providers have been at a higher risk of getting COVID as well, and that continues to be true. However, what the risks to different healthcare providers can be really different as well. So you want to talk to your partner about their work setting and how comfortable and confident they feel about COVID mitigation strategies in their offices, and whether they feel that they can stay safe, they have adequate PPE, that everybody is respecting masking and social distancing, including in break rooms, et cetera, that they're screening their providers and other staff for any COVID symptoms or exposures, and really just kind of respecting one another in that way. You want them to come home, wash hands. I, since the beginning of COVID, have always come home, changed clothes, showered, been a little more cautious, made sure my shoes are different. It's, some of those basic measures. And then beyond that, I think you just have to think about what's practical and how long it's sustainable for. COVID is going to be here with us for a while longer. And I can tell you some of the own safety practices I took in my household in very early times in COVID, I've realized just weren't as sustainable. And I try to be as careful as I can when I leave the house. I feel very comfortable in our work situation and feel very lucky to work where I do. And I feel confident that we're all keeping each other safe, and that our family members help keep me safe by wearing masks. And then when I come home, I just interact with my family members as I would normally.
Thank you. And somebody asked, you mentioned before, just as we were last couple of minutes, so I have about 3 more questions here. You mentioned before about ensuring visitors are up to date with Tdap. How recently do they need to be vaccinated to be up to date?
Ask your adult providers in case I'm getting this wrong, but in the last 5 to 10 years, if they've received the shot, they should be good to go.
Thank you. And somebody asked, are moms being required to wear masks during labor? I realize it's hospital, but in your experience, have you seen hospitals requiring masks during labor?
I have seen that many hospitals are asking moms to wear masks during labor. I understand why that is difficult, but I have seen that that's been an ask.
It's challenging. And one thing I'd say to you and everybody watching, it's something that we're doing. So if you join us at Boober for one of our pain coping classes, we do these different kind of hour-long drop-ins to get you ready to get into labor coping mindset and practice different things. And one of the things I'm encouraging parents to do right now is to practice wearing their mask at home, for just periods of time, and do yoga or do movement or do something you wouldn't normally do while wearing the mask inside, so that you can start to adjust to the idea of having the mask on. A lot of people are going to be wearing the mask during labor right now. And the more you kind of normalize that for yourself in your daily practices, especially if you're slightly exercising or moving around a little bit, because we do often breathe a little bit, much more deeply during labor as we're moving. I think it's helping people to just kind of start to accept that and practice with it and become used to it. So last question, any recommendations for difficult conversations with family members who aren't practicing the same level of safety as you are? That would be a great way to kind of, I think, send off, because I think when we're becoming parents, all of you who are out here with us, and thank you so much for coming today. For many of us, I think becoming parents is the first time you actually really get faced with going, oh, I am now in charge of this being, and I have a lot of other opinions coming at me. And I need to ultimately kind of do what feels right for me and my family now. And so it's a really big shift for a lot of people. So I'd love to hear your thoughts before we head out for the evening.
Yeah, absolutely. And I think this is such an important question for all of us as the holidays come up. And, you know, just kind of watching the trends in Europe and watching the trends in a lot of the US, I think we're all getting prepped to have a difficult conversation. What I would say is have conversations early, and be really honest and open about exactly what you're concerned about. You know, and that's to say some people might be really concerned about making sure that their newborn is not infected. Other people might just be really concerned about protecting their parents who have different thoughts about how to protect themselves against COVID. But bring the conversation up early. And then if you have any questions, any uncertainties about, so, you know, how risky is it to fly versus how risky is it to drive and have to go into the bathroom, some public bathroom somewhere. Talk to your provider. Talk to your provider about when to test family members and what that may or may not mean, and what kind of tests you're going to do and what that may or may not mean. Think about the level of spread where you are, and let that be a guide to making these decisions as well. You also, you know, there are so many different ways that we can come together now. We've all had to be creative. I think we spent the summer just picnicking with family members and friends just 6 feet apart. And maybe this holiday will be about doing activities together rather than sitting down at a dinner table for a long meal. But you want to start thinking about these fun ideas, ways to feel connected, things that you feel comfortable with. And exactly as Jada said, it's really about you draw your own boundaries, you think about what you feel comfortable with. Try to have these conversations early so that you know what you're getting yourself into. I think it's very uncomfortable and can lead to a lot of distress if you show up somewhere thinking it's going to be an outdoor socially distance event, and then people suggest going inside a restaurant, and that's not something that you're doing right now. So just try to be really honest about your limits and set those expectations ahead of time.
Thank you. Thank you so much, Dr. Subedi. And thank you everybody who came out today. I dropped in, and thank you to Hatch and One Medical. Please, reach out to us if you have any questions. Like I said, follow us at Get Boober on Instagram to learn more, anything about pregnancy to postpartum, and just know that, we're really here as a resource. I really, truly, I'm passionate about people getting educated and learning their choices and options. And we just really want you to feel like you can reach out and get good information. So let us know if you need us. We will be sending that follow-up email with some special codes for classes and One Medical. So please open it, and then you can unsubscribe if you don't want to hear from us anymore. All right. Thanks so much.
Thank you guys so much. And you can find information about One Medical on our website and Instagram as well. Check out what we have to offer on One Medical Kids. Thank you all for your time. Thank you for having me. I appreciate it.
Yes, thank you. Bye.
Good night.
Good night.